Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Thursday, May 21st. Let's jump into the numbers from the 8 counties. If you look at the number of people who are currently admitted to the hospital in those 8 counties with COVID-19, that's 108. That's down from 114 yesterday. Another number is the number that are currently in ICUs, and that went from 19 yesterday to 16 today. And Fred, that's 8 straight days where that number has gone down.
That's right, Dennis. It keeps going down, which is terrific.
And that's similar to what's happening here inside the medical center. We currently have 44 people that we're treating for COVID-19. We have 39 on the floor. We have 5 in the ICU, and we currently only have 3 on ventilators. That also is a very low number.
That's the lowest we've had. Of the 44,
yes.
31 of them are patients that are congregate living patients that are positive, awaiting to go back to their either group home or nursing home. So of the 44, only 13 are from the community, the general community out there.
And that gets to avoidable days. And let's talk about that in just one second. One other data point I wanted to mention is we actually had a lot of discharges yesterday, and we had an important moment.
That's
we
right,
discharged
we did.
Our last
New York City patient.
Yeah.
So the last patient that we accepted back in the real crisis days back in April from Queens was discharged yesterday, which is just absolutely terrific.
Fantastic. So back to the patients who come from congregate living facilities. You mentioned that number currently is 31.
That's right.
And we talked yesterday about avoidable days. So let's talk about that a little bit more.
So we said yesterday, avoidable days are days that patients spend here in the hospital when they're not acutely ill and could be cared for in another setting, like their skilled nursing facility, or even discharged back to the group home that they came from. But because of the rule set that the state has put out there, if they're still COVID positive on the PCR tests, they can't be discharged. So we have 31 such patients, and we've now accumulated here in the medical center 133 days, avoidable days, and those are days that patients have been here when they frankly don't need to be here.
Okay. And I think we're having conversations with our infection control people. They're talking to their counterparts in other hospitals, similar things happening.
It's happening elsewhere, and we actually talked about it this morning on our regional call.
Right.
And across the whole region, the 12 hospitals that get on that phone every morning,
right,
there are 289 avoidable days.
Okay.
And that keeps going up.
Let's jump into visitors coming into the hospital. I think today is the first day we're going to start this pilot.
That's right. So as we said yesterday, we're one of 16 hospitals across the state that's been asked to do a visitation pilot. So we start that at 4 o'clock today. So visitors in a very restricted way will be allowed to come in between 4 and 6 this evening to visit patients here in the hospital. They need to register.
Mm-hmm.
They need to do hand hygiene. They need to wear PPE, masks. We'll be giving them masks. They need to be very restricted in where they go to the patient's room and then back when they're done. Only one person over the age of 18. And we want that one person to be the same person every day for someone's time here in the hospital. It's going to be a little bit easier for us to track.
And you mentioned yesterday we're one of 16 hospitals in the state piloting this.
Correct.
For the next 2 weeks, we'll share our data with the state, and then hopefully this will allow for an increase in visitors coming in safely.
Right. That's exactly their intent. So we'll see how this goes over the next 2 weeks.
All right. We've mentioned in this video in the past remdesivir. This is an intravenous medication that's given to people often in our ICU settings who have COVID-19. I believe the literature shows it has had some benefit.
It shortens the length of time that a patient's in the hospital, so it does shorten their acute illness by 5 days.
By 5 days. By getting the drug. And we recently got a shipment of it.
We received 80 vials, which is probably enough to treat 10 patients, depending on the course that they would have.
Very good. And there's criteria how it's used,
Yes.
and that was put together by our specialists and our pharmacists.
Yep, that's exactly right.
So today is Thursday, which means last night was Journal Club. We have it every Wednesday night. I believe the topic last night was COVID-19 and the pediatric population.
That's right, Dennis.
What did we learn?
Well, we learned a couple of things. One of the things that they discussed something called cytokine storm, which is it's kind of an inflammatory reaction. Your body produces these proteins called cytokines that are meant to attack the virus, but get little overzealous in what they do and can actually inflict damage on normal tissue in the body. So that's this inflammatory syndrome that we've been talking about for the past week or two and the state's been talking about.
And I think we'd like to thank a couple of physicians who helped organize this. Dr. Ostroff, she's chair of pediatrics, Dr. Barillas, and a very important doctor, Dr. Liepau, who many people outside the medical center may not know this. Dr. Liepau actually was one of the lead authors on many important articles, New England Journal of Medicine articles, early 60s, working on vaccine trials with Dr. Salk, measles vaccine. She's incredible, and she participated actively in the Journal Club last night.
She did, and Marty is in her 90s and is still sharp as a tack.
She absolutely is.
Yeah.
In addition to those attending physicians, we had many medical students who were involved in last night as well as in previous Journal Clubs. And Dr. Mandeep Sidhu asked that we recognize them, and so you see their names coming up on the screen. Fred, what are the roles the medical students doing with these?
They do a lot of the research, so they go into the literature, look for information on the topic that's going to be discussed, and then actually do the presentation with the faculty members you described actually doing the discussion of the topic after they present the facts.
Well, we thank all the medical students who have participated in all of the journal clubs going forward. And speaking of medical students, we're wearing sweatshirts today for the medical college because it is graduation day. Yes, it is. So this is the 182nd graduation for Albany Medical College. I'm an alum of Albany Med, class of 1992. As I mentioned yesterday, Fred, we don't just graduate people with doctoral degrees in medicine, although we do. We also graduate nurse anesthetists, physician assistants, masters in bioethics, and we also graduate scientists.
Scientists, PhDs and masters in various scientific topics and fields.
So we did it today. It was done virtually, but we're so proud of our 220 graduates. And historically, many of the people who graduate from our medical school stay here or practice in the community. So it's a great resource for the whole region.
The medical college is very important to the health of this community by virtue of that.
So we're going to have a special recognition here. As we say, we're going to.
And Dennis, I'm an honorary alum, so I get to wear this hat, even though I graduated from a different school.
Instead of saying hats off, we're saying hats on. Hats on to our graduates. So that'll do it. So thank you. I think we'll just hand that back.
Yes.
We'll be back again tomorrow. We have some good news on Friday as well, but the week is going very well so far, I think.
It is.
Good. Congratulations to all our graduates. And congratulations to all the people who helped teach them, because really it's remarkable that we have such great education here. Please take care of yourself, take care of each other, and we'll see you tomorrow.